Good afternoon, everyone. I'm Dr. Presanji Adhikary, practicing medicine. So today we join here to discuss about a topic which is little bit undercovered because the topic today is the role of stress in exacerbating acidity. So we all know or we all understand that acidity might occur due to improper food intake. It's not taken in right time. We all know that. But the problem is that the stress is also play a very important role to exacerbating the acidity. And this acidity, it leads to acid reflux and heartburn as complained by the patient. We are all experience stress in our daily life due to some causes which is maybe avoidable or non-avoidable, and it significantly plays a role in impact to our digestive system. So the understanding the connection is crucial to managing both the stress and the acidity effectively. So now what is acidity? First, it's a condition by which acidity occurs when there is a excess production of stomach acid. So there is a acid called hydrochloric acid, which is basically needed for digestion of the food, which release in the stomach. So now when there is a more production of hydrochloric acid in stomach, it leads to heartburn. Second option, when there is a over production of hydrochloric acid, and second thing is improper emptying of the stomach content. This is also one of the cause, can lead to heartburn, indigestion and discomfort. So normally stomach acid help in digestion of the food and the protective phenomena for to kill the germ. Whenever it flows back into our esophagus, it can cause irritation in the burning sensation. It's called heartburn. So the common triggers include certain food like junk food, any type of oily food, overeating, or lying down just after meal, and this also one of the cause. But stress plays a major contributing factor of when what is often goes overlooked. So what is the physiology of stress? The stress in the body naturally responds the challenging situation. When we are in stress, the body releases hormone like adrenaline and cortisol. So the adrenaline and cortisol, these hormones trigger the flight and flight response, which causes more production of stomach acid, that hydrochloric acid. That's why it also leads to increase in the heart rate, heightened alertness, and changes in digestion. While this response is helpful in short bursts, but chronic stress can lead to ongoing the physiological changes, including those that affect the digestive system. Now, how stress exacerbate acidity? The stress increase stomach and acid production. Stress can stimulate the production of stomach acid. More acid means higher likelihood of the reflux into the esophagus, leading to heartburn and the altered digestion. Under stress, digestion can slow down, causing the food remain in the stomach for the longer time, which increase the acid production, and the chances of reflux is high. Third option is muscle tension. Stress causes tension in the body muscle, including those in the digestive tract. This tension can exacerbate the discomfort and the acidity. Now changes the gut motility. The stress also changes our gut motility. It decreases our gut motility sometime, which can causes the food particle more often stayed in our stomach. This also causes heartburn, and sometimes it's delayed our emptying. and sometimes it promotes our emptying. That means it increase our peristaltic movement, which leads to IBS. And when the peristaltic movement, there is an anti-peristaltic movement, this cause the reflux of the acid to our esophagus, which leads to heartburn. The both can happen by the stress. So stress can disrupt the normal movement of the gastrointestinal tract, leading to the condition it's called irritable bowel syndrome, often associated with increased acidity in our stomach. Now, the behavioral changes. The stress can be lead to unhealthy eating habit. Whenever a person is in depression or is in stress, there is a high chance of taking junk food, any type of sweets beverages, which also leads to higher acidity. Some person also increase the intake of alcohol, smoking, which also worsen the factor. And third thing, they are overeating. Overeating also disrupt our problem and worsen our acid problem. So stress can be lead to unhealthy eating habit, such as eating quickly and consuming the trigger food. Trigger food means the junk food and any type of oily food, the sweetened beverages, and drinking more caffeine, coffee, alcohol, smoking, which can worsen the acidity. Now, how to manage the stress and how to reduce the acidity. Now that we understand how stress exacerbates the acidity, let's talk about the strategies, how to manage and how to reduce the condition. So, first of all, is a relaxation technique. How to relax yourself or myself? Practicing like deep breath exercise, yoga, and somehow cool down our mind. This is helps to decrease our stress level. Thereby, regular uh, work is very helps to decrease the stress level. So it can leads to decrease in the production of the stomach acid, and it leads to decrease in heartburn. So regular exercise is one of the factor. Deep breathing is one of the thing. Yoga is helps to and meditation, it helps to control our mind, which can leads to control our that stress. We can overcome our stress. This leads to decreased production of hydrochloric acid or stomach acid in our stomach, which leads to no, there is a no chances of heartburn and acidity. And eating healthy food habit, lots of vegetables, and taken in proper time, it's also one of the factor. Whenever you are in stress, there is a mild chances that you do not take your food at the right time. So this is the right way to take the proper food, proper healthy food in a proper time. This is one of the cause to avoid acidity. So eating slowly, avoid all type of triggering food like any type of junk food, caffeine, alcohol, smoking, avoid all those things. And having a smaller and frequent meal. This is the goal of your diet. Having a smaller, healthy, and frequent food which you can easily digest, and there is a less chances of production of hydrochloric acid in our body. So this is why we can, by healthy eating habit, we can control our acid production. And the last option is the adequate sleep. Sleep is a very necessary to maintain our mental health and physical health. So adequate sleep, at least 6 to 7 hours in 24 hours is very necessary when you are in a very stressful and you are in a very in a condition you can't live. That's why the adequate sleep is very necessary in this condition. So mindfulness and stress management. So If it's not controlled by you, your stress, you can consult with any type of counselor. You can consult with any type of psychiatrist who can counsel you. The medicine is not needed. The counseling can help you to overcome your stress and manage your body's problem and tension, and it also improves your digestive health. So, in conclusion, stress is a significant factor that can exacerbate acidity. By understanding the connection between stress and the digestive health, we can take protective steps to manage stress and reduce the concurrence of the acid reflux. Remember, the balanced lifestyle that includes stress management, healthy eating, and regular exercise can go a long way in maintaining the healthy digestive system. Thank you for the attention. I hope you found this information helpful in understanding the impact of stress in acidity. Thank you.